Hello, happy Thursday. Welcome to another episode of Discover with Spinetti. We're talking about tooth sensitivity. A lot of you have it. I'm going to explain to you why it happens and how you can avoid it in this very short podcast for today. Because as you know, these podcasts have become shorter and shorter for your entertainment and educational purposes so that we don't overload you with too much information. You can have bite sized information and benefit from it all at the same time and maybe even get a little bit entertained. So here we have Charlie with no cap. Let's put the cap on here so we can have our thinking brains on, pun intended. Charlie here has sensitivity in his teeth. He has sensitivity because, we'll discuss that in a second, but Charlie has told me that he's got sensitivity. And we're going to discuss why you may have sensitivity as well. And it's very easy to understand. But you will definitely learn a few things today. It comes down to two basic things. One is the nerve, so the nerve inside your tooth, and the second is your gums. Now you may be asking yourself, Dr. Spinetti, what does the gums have to do with tooth sensitivity? I will cover that in just a moment. I know it's a cliffhanger, but it's for you to stay tuned so you don't swipe away and watch the next cat video. So there are 5 reasons in general as to why you may have tooth sensitivity. The first and most obvious one is a cavity. So if you have a cavity, it is going to lead to an exposure or closer exposure to your nerve. Okay, you're going to hear this over and over again now. So that's the first step. The second reason is root exposure. Root exposure means that now you have gum recession, so you've lost some gum tissue, maybe even a little bit of bone tissue, and now you have your root exposed. Your root being exposed gets that part of the root that part of the root rather, is very close to the nerve. So because it's very close to the nerve, what happens is that as soon as the root's exposed, are you following me? As soon as the root's exposed, now you have a closer distance to the nerve, and that's why you start feeling sensitivity. The reason why you don't feel sensitivity when you have your enamel, the white layer of your tooth, intact and your gums intact is because the distance between the nerve and the outside is so large, right? You want to keep that distance large. And also, the enamel has a very protective layer in that it doesn't allow sensitivity to occur because the tubules, the dentinal tubules, they're not exposed, which is a perfect segue, leads me to the next reason. So for the first one we said is cavity. The second one we said is you have gum recession, and if you lost some bone tissue or gum tissue. And the third one is dentin exposure. Okay, so dentin exposure is when you start losing enamel. So you start losing that white tissue, that nice white pearly stuff that gets whitened. You start losing that. Now you start getting dentin exposure. Dentin is the second layer of your tooth. And once that gets exposed, then now you're even closer to the nerve. And also, these dentinal tubules, they're literally tubes that go directly to the nerve. So that's why you experience a lot of sensitivity, because the mechanism by which sensitivity occurs is hyper activated. The third is if you have any cracks or chips in your teeth. So a lot of times when I'm explaining certain things to you, if you were to look at any of the previous podcasts, you're going to notice that one of the themes that I constantly cover is for you to straighten your teeth, to fix your bite, to align your bite properly, because that decreases the chances of you chipping and cracking your teeth because you have a protective mechanism of your teeth. The last, but certainly not least, are you ready for this? Gum inflammation. So gum inflammation is a reason as to why you may feel tooth sensitivity. I've had a lot of patients who come in and they say, I have tooth sensitivity to sweets, okay, to sweets or cold foods. And I look at their teeth, I examine their teeth, I take an x-ray, and I see that there's nothing wrong with their teeth. The enamel's intact. They may have a small cavity, but that's not enough for them to actually feel the sensitivity they're feeling. And then I look at their gums, and I see their gums, and I see that their gums are inflamed. And I asked them, the first question I always ask, and more than likely your dentist will ask the same question, is, do you floss? Because if the answer is no, then that is the reason why you are experiencing sensitivities, because you're not flossing. So now the gum is hyper inflamed, meaning anything irritates it. And so any kind of, cold sensitivity, sometimes even breathing air is going to lead to that kind of sensitivity. So the first thing that you should do if you're feeling sensitivity is floss. Pick up that string and just start to floss. Alternatively, if you hate the string, there's something called a water pick that you can use so you can get rid of the plaque around the gums and decrease the irritation of the gums. So then that way you can decrease or completely eliminate the sensitivity. What is the general theme here for today? How do you avoid sensitivity? Two things. One, protect your enamel at all costs. Your enamel is more precious than gold and diamonds combined. It's more precious than any Louis Vuitton bag or Hermes bag that you'll ever want, or Ferrari if you're a guy watching this. It is incredibly valuable because once you lose it, you will never get it back. And never with a capital never. So the thing is that you need to protect your enamel as much as humanly possible. The second thing is you need to protect your gums because, again, your gums are the thing that also causes sensitivity and it causes a slew of other problems as well. We covered that yesterday. So if you missed yesterday's talk, it was 7 minutes. I highly recommend you go and check it out. It's literally yesterday's podcast episode about gums and gum inflammation and how that is the thing that you have to pay attention to if you want to keep your teeth in your mouth. Okay, the gums are so essential. So, two things for you to decrease sensitivity, to avoid sensitivity in total, is for you to one, maintain your enamel at all costs, and two, to protect your gums. I have a few tips, and I'm going to leave you with that. I have a few tips on how to protect your enamel. The first tip is for you to use an electric toothbrush. Now, studies are kind of inconclusive as to whether electric toothbrush or the manual toothbrush is better. But, don't jump the gun on me. But if you use an electric toothbrush, the greatest benefit to the electric toothbrush is that it's timed. So there's no guesswork as to whether or not you're brushing for long enough. Because most people don't brush long enough. That's the problem. Most people brush for 30 seconds or 45 seconds or a minute, if that. And then that's it. But they're not brushing long enough. They're not spending enough time. And I'm not saying being aggressive when you're brushing. I'm saying they're not spending enough time brushing and removing all that plaque away, especially in the back. That's where I see all these cavities. So the first one is to use an electric toothbrush. Number one, to protect your enamel. Okay, and also the electric toothbrush has a sensor. So if you're pressing too hard, it'll start lighting a different color. And so you'll see it as a reflection in the mirror and you'll see, oh, I'm pressing too hard, so you can back off a little bit. You don't need to press hard. But that's another thing that the manual toothbrush does not have. And I'm telling you right now, generally speaking, out of all my patients, the ones that use electric toothbrushes, they're the ones that have the healthier mouth. I'm just saying, like, that's straight up, that's like, pure observation. The second thing is, I just covered it, is don't be aggressive when you're brushing. The third is decrease the acidic foods in your mouth. Decrease the acidic food consumption. And something that plays along with that is to decrease the snacking because you want to decrease the amount of acid in your mouth. Now, this is what I'm going to end with, and I'm going to continue this in another podcast, is this. Okay, now this is going to blow your mind because this is called the Stefan curve. The Stefan curve describes how you get cavities and how it actually fluctuates with your eating. So I'm going to share this with you. And I really want you just to pay attention. Now, this is a graph, and I know a lot of people kind of get confused with graphs, but it's a very simple graph. Okay, so I'm going to show it to you. And anyway, I'll let this thing do its own explanation. Okay, so this is called the Stefan curve. And this is what I want you to pay attention to, this one right here. What happens in your mouth when you eat? Now, can you see this, or am I just talking without you being able to see it? Let's see. Yes, you can see it. Okay. Right here. Okay, so you can see this graph here. What happens to your mouth when you eat or drink? Now, this here, okay, where my mouse is, where mouse is, this is the pH of your plaque. Okay, your plaque has a certain pH, and it starts off as neutral, around 7. Now, when you eat, so let's say, for instance, you introduce a carbohydrate, sugar, or any kind of carbohydrate, like bread, or for instance, then what happens is that the acid in the pH decreases. The acid that is produced by the bacteria in the plaque, it decreases. Now, it decreases beyond the point. So see here the numbers. It goes from 7, 6.5, 6, 5.5, 5, 4.5. This is the zone in which you start getting dissolution or demineralization of your enamel. Basically, there's an acid attack. You're basically dissolving your teeth. It's true. You're actually dissolving your teeth in this zone. Now, something else too that I should mention at this point is this is for people that don't use fluoride. So people that don't use fluoride regularly, their enamel becomes dissolved, becomes attacked at this point right here at 5.5. People that use fluoride, their enamel becomes dissolved at 4.5. So between 5.5 and 4.5 is a 10-degree logarithmic scale. And so then you actually get 10 degrees of protection when you use fluoride. And so then in order for your teeth to become dissolved when you use fluoride, the acid has to drop below this point. So you can see the amount of protection that you get when you use fluoride. So let's assume you don't use fluoride. This happens every time you eat. So you get this, and you can see here, this is the time. So the time it takes for the plaque to become neutral again because of saliva and you drinking water, it takes around 20 to 30 minutes for it to come back up to 7. Okay, so if you introduced some kind of sugar intake here, let's say at 7 a.m. here, by around 7:30, okay, around this time here, by around 7:30, you get the pH back to 7. So here you have the exact same thing happens. So for instance, lunchtime, 12 o'clock, drops down significantly. Okay, the pH in the plaque decreases all the way down to around 4-ish, and then it increases back up in around half an hour, right? And if you're a snacker, like let's say you're drinking soda or you're eating chips or whatever in between, every time you do that, now the plaque pH is actually going down, okay, every time. And then you are causing your enamel to become dissolved every time. When it gets to this area, that's when your enamel becomes remineralized. That's why it's really important for you to drink water every time that you eat. Like after you eat, it's important to drink water, to grab tissue or something to just wipe away the plaque, right? As much as possible, in order for you to make sure that you're in this zone as opposed to this zone right here. So I hope this helped. It was longer than 5 minutes. It was 13 minutes. And just keep in mind the Stefan curve. Keep in mind tooth sensitivity. I will continue on this for tomorrow. Hope you're having a wonderful day. And as always, keep smiling.